MySIF app, the management of cystic fibrosis in your hand. Around 70,000 people worldwide suffer from cystic fibrosis. Up to now, this rare disease has no cure. Cystic fibrosis is a genetic disorder that affects mostly the lungs, but also the pancreas, liver and intestine. CF makes mucus in the body stickier than normal and makes organs work less effectively. Because of sticky mucus, lungs, for example, cannot easily get rid of bacteria. Sticky mucus can cause recurrent pulmonary infections, absence of digestive enzymes in the gut, excessive salt loss in the sweat and sterility. Due to the sticky mucus, many patients have pancreatic insufficiency. This means that their pancreas does not supply the amount of pancreatic enzymes that the body needs to digest and absorb food nutrients. There is high-grade evidence that maintaining normal growth and nutrition adds 10 years more to the median survival, as scientists have proved that there is a close relationship between pulmonary function and nutritional status. For that reason, patients with cystic fibrosis need to take supplementary pancreatic enzymes each time they eat to help their body digest food. However, determining the exact doses of pancreatic enzymes is very difficult, as it depends on how much fat the food contains in each meal and how many enzymes the body still produces. The inaccuracy of the pancreatic enzyme doses causes, on many occasions, intestinal disorders such as abdominal pain, constipation, diarrhea, and growth problems at long term. Is it possible to develop a tool for helping patients to calculate their optimal doses of pancreatic enzyme? MySIF app has performed extensive research on food technology analysing the optimal amount of supplementary pancreatic enzymes required depending on different conditions. After an extensive in vitro digestion research, MySIF app has developed a complex algorithm able to predict the optimal dosage of pancreatic enzymes for each patient depending on each food. This complex algorithm has been implemented into an app for patients. For the first time, patients have access to a scientifically validated tool to calculate the optimal pancreatic enzyme dosage in real time for each food they eat. Once patients introduce what they're going to eat, the app calculates the optimal pancreatic enzyme dosage. The app is connected to a professional web tool, so doctors, nurses and nutritionists can do a close follow-up and also send recommendations to the patients, avoiding some problems to get worse. Patients can also register symptoms such as their feelings, so doctors, nurses, nutritionists and psychologists can do a close follow-up. Health professionals can also send personalised recommendations to their patients to help them improve their symptoms. The app also contains the Living with Cystic Fibrosis Handbook, a complete guide of cystic fibrosis based on scientific evidence and written in plain language to help patients understand nutrition with practical and applicable recommendations. MySIF app promotes a new approach to healthcare in which patients have an active role with the support of their health professionals. In this new approach, learning tools are of the utmost importance. For this reason, MySIF app has developed a game app for children. Pat is a nice monster children have to take care of. They have to feed it, practice sports and give it a proper rest. As they play, they learn how a healthy lifestyle can help them improve their general well-being. This tool is being scientifically validated in 6 cystic fibrosis centres through a clinical trial in which around 250 patients have participated.